Every year around 1.75 million blood culture samples are collected in England. The way in which these samples are collected and analysed to determine the cause of infection is known as the blood culture pathway. In this video we'll explain why an effective blood culture pathway is so important for both patient care and antimicrobial stewardship. We'll highlight some of the most important factors for anyone involved in collecting and analysing samples, and we'll signpost resources for further advice and support. An optimal blood culture pathway will make a significant difference to two of the major healthcare issues of our time, sepsis and antimicrobial resistance. Sepsis is a diagnosis used when an infection is so severe that it impairs organ function. It's one of the main causes of death in the UK, accounting for more deaths than breast, prostate and bowel cancer combined. Although sepsis is a life-threatening condition, better patient outcomes and shorter lengths of stay are likely if it is identified and treated early. Analysing blood cultures is one of 6 tasks that can lead to rapid diagnosis and treatment, reducing the number of deaths. The second driver is antimicrobial resistance. Over time, the antibiotic drugs we use to treat microbes become less effective as microbes develop resistance. The threat of antimicrobial resistance is widely recognised as a global issue. The UK government has published a 5-year action plan to help ensure antibiotics remain effective in the future, with a target to reduce their use by 15% by 2024. This requires support for appropriate prescribing by clinicians through reliable and timely diagnostic results. This is known as antimicrobial and diagnostic stewardship. A rapid and reliable positive blood culture helps us to align both of these objectives. The more quickly we can identify the cause of an infection, the more quickly we can provide an appropriate antibiotic therapy, ensuring patients get the right types of antibiotics in the right quantities, or even suspending their use when not appropriate. At the same time, sepsis can present in many different forms, and a positive blood culture suggests the best way to investigate the infection and manage the patient, improving levels of care and reducing the length of stay. The recommended standards for the blood culture pathway have been set out in guidelines by Public Health England. This identifies 3 phases to the pathway. Pre-analytical is measured from the time from blood culture collection to loading it onto the analyzer. Analytical is measured from the blood culture flagging positive for a microorganism to the time identification and sensitivity results are available, information which is key to managing the patient. And post-analytical is measured from the time the result is obtained to the time it's reported to treating clinicians and the patient treatment is modified. The guidelines set out evidence-based time standards for each stage of the pathway. Clinical teams and laboratory staff need to work together to improve against these standards. Further information about these turnaround times can be seen in the standards document. Prior to these stages, however, there are 2 key areas where we can all make a difference to the optimal blood culture pathway: collecting samples and the time taken to deliver these to the laboratory. Collecting the optimum volume of blood for a blood culture is the most significant factor in obtaining a reliable result. The guidelines recommend 2 sets are collected, but it is the overall volume of blood which is more important. Guidelines also recommend at least 20 to 30 millilitres be collected per set for blood culture. This is due to low concentrations of bacteria in the bloodstream. This should be taken as soon as possible after the onset of symptoms, and ideally before any antimicrobial therapy. In reality, the amount received for analysis often falls significantly below this level. Studies show that a small increase in the volume collected can have a significant effect on the rate of detection. Once the blood culture sample has been taken, it's essential that it's transported to the laboratory and loaded onto the analyzer without delay. The bottle should not be loaded onto an incubator in the interim, as this will affect the rate of detection in the analyzer. Bacteria grow optimally at 37 degrees Celsius and if left at room temperature can enter a dormant state or become unviable. A single hour of delay might translate to a much longer time to detection of a positive result. The guidelines recommend no more than 4 hours from collection to loading. Hospital and laboratory management should have appropriate arrangements in place to meet this standard. Evidence shows that more than 24 hours can elapse from the time the sample is collected through to loading onto the analyzer. It's the responsibility of all of us to ensure blood culture samples are not left lying around, either after collection or following arrival in the laboratory. An optimised blood culture pathway helps align the requirements and national drives to tackle both sepsis and antimicrobial resistance. The standards set out by Public Health England show what an optimal pathway looks like, and provides NHS frontline and laboratory staff with standards they should be working to meet at each stage of the pathway. Individually, we can each make a difference early in this pathway. By increasing blood volume, the number of detected bacteremias will increase significantly, and by minimising avoidable delays, the time to detection and time to result will be shortened significantly. Organisations should monitor and audit both times and volumes to inform a continuous cycle of improvement and education, supported through local governance arrangements. Good practice in these two areas could help locate the source of infection and inform further management, ensure patients are on the correct treatment and improve outcomes, and support a more appropriate use of antibiotics, which is ultimately of benefit to all of us.